So, picture this. You've got an organ in your body right now that can literally expand its capacity by up to 50 times over your lifetime. No joke. When you're born, your stomach is absolutely tiny. It holds a mere 30 milliliters. That's basically just one single ounce of fluid. But as you grow up, this incredibly distensible organ completely transforms. It balloons up to comfortably hold anywhere from 1,500 to 2,000 milliliters. That is up to 2 whole liters. This jaw-dropping flexibility is really just our first clue that the human stomach is way more than a simple sac. It's this dynamic, highly adaptable marvel of biological engineering. Welcome back to The Explainer. Today, we're going to take a bit of a grand architectural tour of one of the body's most dynamic, hardest-working organs, the human stomach. I absolutely love exploring how our bodies are put together, and honestly, the stomach is a masterclass in form meeting function. We're going to check out its blueprints, its plumbing, its wiring, and exactly why the physical structure of this organ makes it so perfectly suited to break down our food, but also why it's so vulnerable to our modern high-stress lives. Here is the quick roadmap for our tour today. We'll meet the mixing bowl, check out the external anatomy, explore the mucosa lining, look at the stomach's neighborhood, map out the plumbing and wiring, and finally ground it all in some clinical realities. All right, let's jump right in. Meet your mixing bowl and its external anatomy. Now, you probably know the stomach is tucked right up there in the upper left part of your abdomen, mostly taking cover underneath those lower left ribs. And we usually think of the stomach as having this standard J shape. While that's mostly true, its shape is actually surprisingly variable. Depending on your specific build, your stomach might look more like a reversed L, maybe a semi-lunar shape, or even a steer horn shape if you happen to be a bit shorter and more robust. And get this, the shape actually changes within your own body depending on whether you're standing up or lying down, your breathing, and obviously how much food you just ate. Let's look a bit closer at the external facade. The stomach basically has two main borders, which we call curvatures. You've got the shorter, concave border on the right. That's the lesser curvature. Then you have this long, sweeping, convex border on the left called the greater curvature. And these curvatures aren't just for show. They're actually absolutely crucial attachment points for protective ligaments and fatty aprons, like the omentum, that literally drape over your intestines to keep them safe. If we look at it structurally, you can think of this building as having 4 distinct rooms. First, you walk into the cardia, the entryway where the esophagus connects. Above that is the fundus. It's this dome-shaped upper section that usually sits full of swallowed gas, which, yep, is exactly what produces a burp. Then you drop into the main, massive central room, the body, where all the heavy mixing happens. Finally, things taper down into the pyloric part. The very end of this section is the pylorus, which actually translates to gatekeeper. It's got this thickened ring of muscle acting as the ultimate bouncer, tightly controlling exactly when and how much of your digested food, which we now call chyme, gets discharged into the duodenum of the small intestine. Moving right along, let's step inside and check out the mucosal lining. If you were to peek inside an empty stomach, it wouldn't look smooth at all. The thick, velvety mucus lining is thrown into these numerous longitudinal folds called gastric rugae. Think of them like the deep architectural pleats of an accordion. When your stomach is empty, these pleats stand out a lot. But as you eat a big meal and the mixing bowl fills up, these rugae actually stretch out completely flat. This is the secret to how the organ can dramatically expand its capacity without the internal pressure rising to, well, a bursting point. Now, looking closely at the interior, you'll see the rugae are kind of irregular in the main body, but right along that shorter, lesser curvature we talked about, they form a very distinct temporary longitudinal groove. It's called the gastric canal, or Megannstrasse in German, which translates perfectly to stomach street. This canal is basically a fast-track highway. When you swallow liquids on an empty stomach, they bypass the main mixing bowl entirely and shoot straight down the street. It's super efficient, but there's a catch. Because it funnels liquids so directly and rapidly, this specific area takes the maximum hit from things like irritants, alcohol, or super spicy foods, making this highway highly vulnerable to damage. Okay, let's step back outside for a second and look at this stomach's neighborhood. Your stomach doesn't just float around in empty space. It actually rests really comfortably on a bed of other crucial organs. Now, in med school, anatomy students use a pretty dark mnemonic to remember exactly what structures make up the posterior stomach bed, meaning the stuff directly behind it. The phrase is, Dr. S3 kills patients mercilessly. I know, it's pretty morbid, but honestly, it works incredibly well for locking these structural relationships into your memory. Let's map that mnemonic out really quickly. D is for the diaphragm sitting above. S3 stands for three structures that start with S: the splenic artery, the left suprarenal or adrenal gland, and the splenic flexure of the colon. K is for the left kidney. P is for the body of the pancreas, stretching right across the middle, and M is for the transverse mesocolon. So why does this matter? Well, because these structures sit directly behind the stomach, separated by just a thin space. A severe ulcer that burns right through the back wall of the stomach can literally leak potent stomach acid directly onto the pancreas or the splenic artery. As you can imagine, that creates a massive medical emergency. Next up, let's trace the plumbing and the wiring that keeps this whole thing running. To sustain all that constant churning and acid production, the stomach needs a massive amount of blood. This incredibly robust plumbing system is supplied entirely by branches of the coeliac trunk, which is a major artery springing straight off the abdominal aorta. Just look at how these arteries literally hug the organ. The right and left gastric arteries form this complete loop hugging the lesser curvature, while the gastroepiploic arteries sweep all the way around the greater curvature. This redundancy is brilliant. It ensures that even if one pathway gets blocked somehow, the stomach's blood supply won't be interrupted. Now, just as important as the blood going in is the lymphatic drainage coming out. Think of it as the body's waste removal and immune surveillance network. Anatomists divide the stomach's lymphatic drainage into 4 distinct territories, and each one routes to specific clusters of nodes before moving up through the body. Understanding these specific pathways is absolutely critical for surgeons because this is exactly how they track the spread of gastric cancer. A tumor starting in one quadrant will reliably travel along its specific lymphatic highway first. Sometimes, it even causes an enlarged lymph node all the way up in your left collarbone area, acting as this distant early warning sign. And then we have the wiring. The stomach's daily operations are heavily automated by your nervous system. The parasympathetic control, that's your rest and digest signal, is completely driven by the vagus nerves, which drop all the way down from your brainstem. You can see the anterior and posterior vagal trunks spreading across the stomach surface here, almost like a web. These nerves directly order the stomach's parietal cells to pump out highly corrosive hydrochloric acid. If this wiring is a little too active, you get excess acid. Actually, fun fact, historically, severing parts of these vagus nerves was a legitimate surgical treatment to cure chronic stomach ulcers. All right, let's bring this all together with some clinical realities. So what happens when this perfectly balanced anatomical machine gets thrown off by the realities of our lives? Our bad diets, our high stress? Well, when the balance fails, we start seeing clinical issues like gastric ulcers. By definition, a gastric ulcer is a physical breach, an actual break in the continuity of that thick mucus lining we were looking at earlier. Remember the Magenstrasse, that stomach street on the lesser curvature? Since it's the fast-track highway for swallowing, it sees the most friction and the most direct contact with irritants like alcohol, heavily spiced foods, and even certain pain meds. Because of that, the lesser curvature is, by far, the most common site for these painful ulcers to pop up. There's this classic old medical aphorism that goes, hurry, worry, and curry often cause peptic ulcer. It's catchy, for sure, but what's amazing is that it's grounded in pure anatomy. Curry refers to those physical irritants rushing down the gastric canal. But hurry and worry? That relates directly to the sympathetic nerve supply. When you're constantly tense, your sympathetic nervous system is firing on all cylinders. And these sympathetic nerves, coming from your T6 to T10 spinal segments, they don't just put the brakes on digestion, they're the main pathway for transmitting pain signals from the stomach right up to your brain. So your stress is physically, literally wired into the walls of your stomach. So we've taken the full tour of the architectural blueprints of the stomach, from its mind-blowing ability to expand and its internal fluid highways, all the way to the intricate web of blood vessels and vagus nerves that command the whole operation. It really is a stunning piece of anatomy, and it's deeply, intimately connected to your brain. So I want to leave you with this thought to chew on. Knowing that your vagus nerve acts as a direct, high-speed cable from your brain to your parietal cells, controlling the very acid that digests your food, how is your current mental state, your daily stress level, actively reshaping the internal weather of your own mixing bowl today? Take a deep breath, maybe give your vagus nerve a little break, and thank your stomach for doing all the heavy lifting. See you next time.